Hi, I'm Char Miller and I'm with Rocky Mountain Health Advocates. And I always say, let's wake up about health advocacy. And whenever I talk about waking up to health advocacy, people say, what exactly does that mean? So I'm here today with Elaine O'Bleness, who really is a board certified professional expert health advocate. And boy, I tell you, she has quite the background and is an amazing amount of information. I have learned a lot. And not only that, I am going to change my what if about my health advocacy plan for myself and my family and loved ones, and also help the community and many more. So Elaine, help me understand this. What exactly is health advocacy or navigation or health support? What exactly is health advocacy really mean?
What if you or a loved one were just diagnosed with a very complicated, serious condition, and you had no one to be with you to go to appointments or procedures? Your medical bills are coming from everywhere. You had no one to help you to make decisions, or no one to help you in end-of-life conversations, help your family with end-of-life conversations. You didn't understand the medical bills. You didn't understand what your insurance would cover. Those are the times that I, as a patient advocate and navigator, come alongside the patient and the family to just give them really peace of mind and to navigate the healthcare storm.
I'm aware of where family members or a parent or a child or even a spouse have had confrontation or difficulties communicating with one another and being on the same page about the health care of a loved one. And oftentimes the family members are all over either the world or the country. They're oftentimes not even in the same town.
Right.
Which can also be very cumbersome.
Right. It's important to remember that not only the client is in crisis, but the family and the loved ones are also in crisis. So many times there's differences of opinion on what should happen with the patient, whether or not they're competent to make their own decisions. One of the things that an advocate really does and help a lot with is attending or accompanying the patient to appointments, to procedures, and even setting bedside with the patient while they're an inpatient, and making sure that the meds are given right, etc., that the doctor's wishes and orders are carried out, and that the patient wishes are carried out. Patient autonomy is number one. Mm-hmm. Many experts today are saying that you should not enter the healthcare system without an advocate.
Have an advocate or at least a proactive plan.
Right.
Ahead of time.
Right.
Before the what ifs happen.
It's important to know that a patient advocate is not a medical caregiver, is not an attorney, is not a mediator. They are a person that researches and gives options to the client. Sometimes the patient or client doesn't understand that they have a legal right to access their medical records. And there are ways that you can access them electronically. There are ways that you can access them manually if you need to. One of the first things that the patient advocate does is access the patient's medical records and get it on a continuum, on a timeline, so that the patient can understand it. But that brings up the point that many times once the patient gets the medical record, they don't understand what the lingo means. And so one of the things that an advocate can do is explain what is meant in the medical record and explain the medical record to the patient. An advocate does not transport a patient because of obvious insurance reasons, but they can arrange for medical transport. What a patient advocate can do is they step in with the patient and the family and try to diffuse these conversations. If that doesn't work, which sometimes it does not, an advocate can then research family mediation services, possibly within the facility or outside of the facility, and offer that information to the patient.
And as well as perhaps find telehealth opportunities.
Right.
Where
Right.
transportation's not even needed.
Absolutely.
And oftentimes we think we just have to go to the doctor.
Right.
And the doctor can't always come to us.
One of the new services that is in the foremost today is telehealth. And it's interesting to note that everyone thought that telehealth and the senior population would not go along with telehealth. And it is the number one service growing in Medicare.
Interesting. With respect to a patient's autonomy or HIPAA or their private information, how would a patient or health advocate support that patient with the family while protecting that private information?
Right. This is a really fine line for a patient advocate because many times the advocate is actually hired by the loved ones or the family. But the patient's autonomy and confidentiality and privacy are utmost. And so sometimes it's hard for the family who hired the advocate to understand that the patient's privacy is number one. That is a HIPAA law, and that is one of the things that the advocate absolutely adheres to.
Correct. So what is the form called that most of us have seen that where the patient signs off on? And to me, it seems like, yes, that's a document, but a health advocate can do more than just that document. And oftentimes they don't even have it signed. Where can a health advocate sign that form, and how is it different than the health advocacy role?
Right, and the health advocate does not sign the form. That's called a durable power of attorney for healthcare decisions. Every person should have executed a durable power of attorney for healthcare decisions, regardless of their gender, regardless of their age, etc. And what that tells you is what is your wishes and your decision maker. And the one thing that the patient advocate does for this is that they make sure that those wishes that are documented are of utmost importance within the healthcare system. They are honored by all of the caregivers.
I think even before the what if happens, that is exactly the thing that we all should have an easy to find location in all of our offices, as well as our family members know where to find it.
It's very important that everyone, that regardless of age, regardless of sex, regardless of whatever, that your durable power of attorney is executed and that your family members know where it is. It's very easy to find the forms. All you have to do is Google durable power of attorney, and all kinds of references come up where you can get all those forms for free.
Elaine, I have actually had my own challenges with billing in health. All the bills that get piled up, not only for myself, but also my family members. How can a health advocate truly help a family or an individual with their billing concerns and matters?
One of the things that a patient advocate does is that they help the client to organize the medical bills. To do that, you have to have a copy of the patient's insurance coverage so that you know what's actually covered. And then the advocate helps the patient to organize the bills, to make sure that the bills are getting paid properly, and that the patient does not pay bills that they don't actually owe.
Let's talk about insurance for a minute here, because that is very confusing. There's all different types of insurance, be it private insurance as well as Medicaid, Medicare. How can a health advocate truly clarify, simplify, and explain insurance to their client?
Mm-hmm. One of the things that an advocate really does help with is navigation through the insurance system to help the client to know what they qualify for, what the different options are on the commercial side, on Medicare, Medicaid side. It is a complete navigation through health insurance to know what is the proper plan for the patient and how to access that coverage.
So Elaine, what do you think the difference is about a health advocate that works for the provider versus a health advocate that works for the client? Some of us don't even know what the difference between in-network out of network PPO, HMO.
PPO, HMO.
It's very, even
Right.
on that, even with a company's health benefit coordinator who oftentimes have no time
Right.
or ability to go into that explanation. And HR obviously doesn't always have the answer either.
And
even in
one of the
companies.
things that the advocate does is they're working for that client. They know what's the appropriate coverage for that client.
Correct. And oftentimes there's books and volumes of information,
Yes, there is.
but it's hard to really comprehend
Mhm.
without that lingo and language
Absolutely.
around benefits and insurance. But wouldn't, Elaine, you think it's proactive to have a family discussion before you need that?
Oh, of course it's
And
proactive.
that way everybody, expresses their wishes in those circumstances.
Of course it's proactive, but I will tell you it doesn't.
No, it usually happens after the major accident or the health deteriorates.
It's
And-
critical
or
that,
the-
that families talk about this, but they do not.
Correct. Well, it's a very sensitive topic and it's scary to talk about.
Mm-hmm.
Suddenly you wake up one day, you get the tragic phone call. I've been there. And you're like, everybody's scrambling and trying to figure out what to do.
Right.
And there's children involved, like my case with a couple of my examples, right?
Mm-hmm.
So having some kind of proactive understanding about how the law works.
How the
and
law
what-
works and what
and
the
patient
patient
rights.
wishes are.
Yes. Thank you for joining us. Boy, that was quite an exciting and very informative information about what health advocacy is. Again, let's wake up to health advocacy. I think we need this in our country today. We need this in our communities. And what a gift. What a gift to understand it for yourself, but also those around you. So I appreciate you joining us today and really getting to the point what health advocacy is all about.